hi. You're for the first time in Romania, right?
Yes, this is my first time in Romania.
And what have you come here for?
Well, I come basically for teach my new Pilates clinical education and also a program for physical therapists.
Okay, this sounds complicated, but maybe it isn't. What exactly is your method?
Well, Pilates clinical education is a natural program that I created 5 years ago when I started teaching outside of my country in Italy, Turkey, Russia, Germany. So I was visiting different studios and I offered to the owners the opportunity for work with clients in my area, people with chronic disease. Then I say, why I can show also what I am doing to others for students. So I create in this moment my idea to teach for students also at the same time that I am working. Right now is what I am doing now in Romania. I take clients here and the students come and they can see what I am doing.
So basically that means that somebody who is in pain comes to you to fix the problem, right?
Yes.
What do you do to fix the problem?
Well, it is a process with the first interview, the evaluation, and then you have to design the objectives for everybody. It's not easy, it takes a lot of years to understand the whole process of the health, but I create now a new method that I hope will help a lot of people.
What exactly is this new method?
The method is 3 important points. Is the location of the problems, is the analysis of the problem, it means the cause. Normally we are working with mechanical cause, it means the biomechanic. And then the third part is the facilitation, that means how I will solve the problem.
Okay, let's take it one step at a time. Let's take an example. If my shoulder is sore, I have a problem here, and I come to you, what do you do?
Well, first I will do an interview, know you, what are you doing, what do you think about what is the cause of your problem, and you will let me know if you have this problem, how many weeks ago, so I will know if it's just a punctual problem or it's a chronic. And then we are going to give you the location of your problem. I will show you what means a shoulder, how many structures in your body are connecting with your shoulder, for example, and then you are going to know the anatomy and the biomechanic, and then it will be very easy for me to work with you.
I have to know. So it's not enough that you know it, I have to know it.
Yes.
And I have to do a lot of work, I suppose.
Yes, you have to be a part of the process. You cannot be passive. That's the big difference.
Okay, let's go to the last part of your method. How do you fix the problem? What do you have to teach me?
Well, in the recovery, in the rehabilitation, I will use the manual therapy. It is for me the powerful technique or methodology, and I will use the movement, both. But first I will start using my techniques manuals just for try to understand better the process, and then try to get out the pain, and then start with a stabilization of the problem, and then with the movement again. So I will restore the movement basically in the most common pathologies without pain.
So I'm thinking I have to do things. What things do I have to do? I have to do certain exercises, right? Certain exercises so that the pain will go away and the problem will go away.
Well, exercise is the last part of the process. At the time you recognize what is the problem and the cause of the problem, then it will be very easy for you to understand what kind of exercise you need.
What exactly is new about your method?
Yeah, The method, like I say, L.A.F is the method that I told you now in 3 parts. For me, it's not new. For me, it's logical.
You developed it.
Yes. Well, I developed a method for work with the method because I start working with Pilates method. I love to work with this system. It's great, but I think that the Pilates method, like others, need the correct steps for develop the protocols, and especially in the rehabilitation area.
The correct steps. What do you mean by that?
Yes, it's not the same the order of exercise for the benefits.
So if I have a problem with my shoulder, and let's say my mom has a problem with her shoulder, then we probably have to do different kinds of exercises or different orders of exercises.
Well, will be very similar because the anatomy is very similar in everybody, but the question is that you will have to do the steps first for stabilization and then for mobility. And it is very important for exercise. When you are going to start with exercise in your shoulder, I will be sure that you understand everything about your problem.
Can any problem, any movement problem can be solved?
Well, there is some problems that, the chronic problems that sometimes it's difficult to solve 100%, but always is better than nothing. You have to do something.
You can alleviate it.
Yes, and the person have to be implicated in the process. If no, it doesn't work.
So it will definitely not get worse.
Yes.
It will get better.
Exactly.
Okay, so now you work with people, you solve their problems, you work directly with patients.
Yes.
But you also work with students.
Yes.
That will do what you do to others, right?
I work with the students because I think it's great that they can see what I am doing directly. Because when I was teaching for physical therapists or trainers, my programs, I have to imagine the situation for teach. Okay, imagine that this person is like this or like that, so it doesn't work. When they can see directly, like is the problem or the process directly, then it's working because they can see very easy like to work and like to adapt exercise, so my method is faster. And faster means efficient.
You sound like somebody who's happy with what he's doing.
Yes, I'm very happy because it's my passion and because I like to help everybody. And I am very happy to know other countries and to take knowledge also about what the people need. And what I am looking now forward is to visit more and more countries and can work with more and more people and teach everybody my experience.
Okay, so good luck with that. You're doing a good job.
Thank you. And now, like this. Okay. Okay, push me here. More. More. Now breathe. And relax. More flexion. And breathe again. And relax. And now stretch here. And only breathe here. Breathe. Okay, and relax. Now roll back. Roll, 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 roll. And breathe. Okay. And stretch. Okay. Here. Here. And now touch here in this point. You have the ribs like this. And you take the rib like this. And now you are going to locate this area here. Yeah. And then you are going to facilitate flex. Don't move your hand now. Flex, flex. Okay. And like this you have this point, okay? And when you facilitate and you do this, she's going to move. You do something like this, okay? You have to do something like this. Now roll. And now you have to do something, don't move your hands, just do this. She's going to move. Look now my hands. Okay. Look, breathe. Breathe. Okay, lie down on your back. Bend your knees. You have to record my hand and now push me back and slowly push me, more, and go forward. Okay, and push only here. Push, more, and relax. And push now, push, and go forward. Okay. Breathe. And now exhale and contract your abs. And stay there. So breathe in. And exhale. Okay, otra técnica, turn from here, this is the scapula, here, okay, scapula, okay, there, this is the 7th thoracic, here, okay, in this point, this is the 1st thoracic, we are going to work over here, so when you breathe, push me here up, when you breathe, up, and now in this point, I will do something like this, and now extend your column, yes, like this, and yes, okay, so you can see now the elongation here in these 2 points, okay, yeah, no, okay.